Hello and welcome to Read Scholars Live. I'm your host, Dr. Mary Fleming, and current president of Read Scholars. Today, I am excited to be joined by Ms. Chelsea Dade, who is a health communication specialist, and community engagement manager for the Kaiser Family Foundation, and also the creator of Communicate for Health Justice. Welcome. How are you today?
Doing well. Thank you for having me.
And a happy new year is in order, right? So we're in 2022 and trying to see what this year has in store for us.
Absolutely.
So I wanted to touch on a couple things today. So you have a varied background. So we're going to try to get into a little bit of each of those components of your life and career. But start off with just tell us what a health communication specialist is. So probably people will want to know what that is, and then you can give us a little background on how you got started on that pathway.
Sure. So health communications as a discipline, it's an interdisciplinary field that's focused on creating, analyzing, and disseminating health education materials, whether those are physical materials or digital materials, and then also how those are disseminated in both public health and healthcare spaces. And so that's how health communications is loosely defined and mainly defined by the CDC.
And then what interested you? Did you, when you were a kid, you said you wanted to grow up and be a health communication specialist. How did you go down that pathway?
Yeah, so I didn't actually know about health communications till after I graduated college. So I think I heard about it just through a Google search on CDC, and it was just like, oh, what is this field? And when I was in the DMV area, Washington D.C. area, found that there was an agency that focused on health communication, making materials for different audiences and also for other government agencies. So your NIH, your CDC, and I thought that was just a really creative process or field to be in. And so did an internship in health communication space while also working to create and to support the development of health education materials for students in the Washington, D.C. area. And so I was a teaching fellow where we kind of were supplementary to schools that didn't have comprehensive health education or reproductive health education curriculums in school. And so we, utilized a curriculum that was OBGYN approved and, brought that to the students, whether that was during school or after school. So I was just really excited about, creating and analyzing and how to make materials better for everyone. And I just saw so many elements of equity and diversity in this one field, and it just called to me. So yeah, that's why I'm still there.
I like it. And so, we as individuals outside of, our day jobs, of course, interact with health information all the time, right? Like you said, from a public health standpoint, when we go to see a clinical provider, whether that's in dentistry or medicine or even physical therapy, like across the spectrum, we have to be able to receive that information. And I think a lot of times we think about health literacy and actually understanding the information at its baseline. So we spend a little bit of time thinking about that and making sure that information is written in a way that everybody can understand it on, based on where they come from. We also talk a lot about making sure people hear what we say, right? So we can share information, but it doesn't also mean that they can process it. So we talk a lot about having people repeat the information back to us to make sure they heard it, bringing a support person with you when you're going to hear complicated or unexpected news. But there's also something that I was reading one of your blogs, and you said, just because a message is received doesn't mean everyone can act upon that message. And I thought that was another place to underscore. And I think that was especially important during the pandemic, right? So we have all of this information out there and all of these things about quarantining and social distancing and not, working from home. But not everybody can do that because of our equity issue. So just wanted to, kind of give that back to you and see if you had any comment on helping people understand messaging and making sure that it's not just making sure that information is understood, but, what do we do with that information when we go home?
Yeah. And that's very powerful. And thank you for, reading my blog about that. I wrote that some time ago, but I think I almost wrote that before the pandemic.
Yes, it was before the pandemic, right?
Really applicable right now. Well, I actually had a conversation about this yesterday. I think message testing is super important, and having, I don't like the word focus group, but making sure that you are working with communities when you are creating messages, because they are the experts in what you are creating. Because if you're not necessarily working with communities, then you're creating messages that or maybe something that you personally would respond to. And there, in health communications, it's a great example because it's a very highly academic space. And it's important to have community engagement backgrounds in that space, or else all the messaging kind of replicates you talking to a peer in your institution, and that's not necessarily the goal. Actually, someone I can't remember who exactly I talked to. I talked to a lot of people, which is always fun. But someone had asked me about a message that they had seen, and it had stated something about the FDA, and the person told me, well, I understand why you're putting FDA in this phrase, but someone in the community might, think that the FDA is the FBI, or these acronyms that we tend to use very loosely in public health and healthcare spaces are not necessarily utilized in other places. They may be, but they might also not be. And that really stuck with me as well. We think and we know the acronyms CDC, FDA, NIH, but does everyone know those acronyms as much as we do? And so there's a lot of importance to testing messages in community first. But overall, I'm a young professional, but I think being in health communications has really kind of given me a lot of experience, because it's all about community. It's about equity and listening more than you speak.
Indeed. So that transitions us very well into me asking you about your platform. So you are the creator, let me get it right, of Communicate for Health Justice, right? So what prompted you to start that, and what are your main objectives or your mission of the platform?
Yes. So I built Communicate for Health Justice in the winter of 2018, kind of as I was reflecting on all the lessons that I had gained in my graduate program, and then even my prior experience. So I was kind of comparing and contrasting the academic lessons that I got in health communications with the actual kind of lived experience that I had prior to, and then even during my master's program. And as many people will agree to, there's a lot of room for addressing principles of equity, principles of diversity and inclusion in health communication. And that's, if you're talking about public health communication, or healthcare health communication. And so with that, knowing that I was fresh out of school and I wanted to still create a space that for people like me, for people who were interested in learning more about this, but also kind of wanted to train per se, I created Communicate for Health Justice, really with a focus on helping the next generation of health communication professionals to write better, to create better materials, to design better social media posts with that element of equity and inclusion. And so it started off really, very much as a blog. And so I would have writers, write in like, this is an awesome space. Can I contribute? And then it grew into, okay, let's add some more social channels. Let's, introduce some new themes into the world. And it was really getting a lot of attention. Actually, one of my, if there are people who are folks in health communication space that I always looked up to, who have been really responsive to the platform that I created, which is a huge honor when you can build something and folks who've been in a space for a long time are like, this is very good. And so with the platform, I've also had different professionals come on, usually on Instagram or YouTube Live to share why does equity and inclusion matter in health communications. And so it's been a really great process, and it kind of happened very naturally, I think. Nothing was forced, and it just kind of came together. And so, and we might, talk more about this afterwards, but it's a really true testament to believing in yourself and believing in your unique skill set, and not being afraid of what makes you you.
I like that. I do want to touch back on that, but I want to go back just a second. And so we were talking about health communications and public health, especially, and thinking historically on how those messages were communicated, right? So it used to be on billboards or posters or mailings, right? And so we have a lot more access to different vehicles of communication now, especially with social media. And now we have a plethora of social media platforms. And so I know you have a creative background. And so you were very purposeful about using the word creative and creator of your platform. But I think it's important to touch on that, in that we can't do the same thing the same way we used to. One, because we're different as a community, we're different just as a world these days. We have different platforms to talk on. We have to be more creative and more flexible, draw on different components of ourselves as individuals, but also, again, as we change as a nation and the world, we also are adding different elements of diversity and inclusion factors in that. So talk a little bit about that and how you pull on those different skill sets, and even maybe a little bit about the pitfalls of having so many vehicles of communication and miscommunication as well, right? One goes with the other. So, just talk a little bit about those things.
Yeah, that is a great question. I would say that my generation, we are probably, a subsection of some of the first to really utilize social media for some of our platforms. And when I say that, I mean, like, firstly, Twitter, I think, that really kind of came about in the past 10 years or so. And then Instagram. I would focus on those two because, my platform itself doesn't necessarily use Facebook. But at the same time, the more channels you have, the more maintenance of those channels you have to have. I would say that's probably one of the main things to definitely, for folks who are thinking about creating a platform, you might want to focus on having one social channel, because then you can really put your energy into that. Another piece of it is kind of what you also said. Even in public health or healthcare spaces, so there is sometimes a kind of hesitancy to post your content on an Instagram page. Not everyone is embracing like Instagram yet, but Instagram is probably one of the places where you are going to reach the most people. And by saying that, I mean also generationally. There's studies about that. It reaches most generations. And another thing is, not being afraid of utilizing newer platforms, specifically as some of Generation Z, ages into the workforce. Some of them are not even using Instagram. So it's like finding those other channels that, that are going to maybe not be as popular, like identifying the ones that are changing in popularity. So that's a large piece of social media, knowing what platform is the most popular at one point in time, knowing the hashtags to use, and then also just building your social media presence is super, super key. But I will say that the way to do that best is through collaboration. And so hashtags are great for that, because if you're using a shared hashtag with another organization, then you can build together. So yeah, there's definitely power in social media, but also it's important to know when to, unplug from it, personally, or even for your organization. I think COVID specifically has really introduced that, internalizing when you think you need to take a break, when you think your organization needs to take a break, and then just kind of, bringing it back when you feel ready.
Thank you. That was a great place to underscore, because I do think sometimes it can get overwhelming. So much content, so much information, and that it is okay to unplug. That doesn't mean you have to, delete it or turn it off forever, but you can definitely unplug and come back. And I think more people are appreciating that these days, and just, being very protective of your mental health in general, which is not what we're talking about today, but it is important to think about. Again, we were talking about ourselves as whole people, and that's part of it. And so kind of last thing before we go, we touched a little bit about kind of being true to yourself as an individual, and then thinking about, and we just talked about social media and being able to see how you're interacting with that and how that can help you, or if you need to take away, if it's taken away from you. And then we talked about being creative and honoring that space. So just talk to us a little bit about either how you've negotiated that space as an individual or helped others negotiate that space, about, trying to be true to your whole self, and how do you put that into whatever you're building, whether it's a platform, whether it's a career, whether it's an interview, and how we're using kind of your communication background to apply to that as well. So kind of we'll pull all the pieces together.
Yeah, most definitely. So as I mentioned earlier, I am a young professional, but I actually do have opportunities to mentor folks who are younger than me, whether they are in high school or college or recent grads. And something that I really do emphasize to them is, don't feel afraid of your creativity. I think a lot of, if we're talking about work, like I think a lot of workspaces are, being more inclusive of creativity, because they understand that, generationally, I think a lot of millennials and Gen Z, like that's some of the energy that we're bringing to everything. And also I encourage people to continue like fleshing out their own work. So for example, Communicate for Health Justice, like, I've taken breaks with it myself, but I still hold on to it because it's honestly gotten me through a lot. I think, having a creative outlet has been very helpful for me in the past, 5 years or so. And so I definitely encourage people to have that creative safe space for themselves. And yeah, just not being afraid of, your unique traits is super key. The platform that I created, I didn't necessarily know everything that I was doing. Like when I made it, like if you scrolled through the Instagram at the very early posts, like they have improved significantly since 2018. But I learned as I went, and I've gained a lot of skills that I think that employers have seen. people, my peers have also seen, my mentors have seen, the change and the growth in me. And then even so, like, you never know when you build something who will see it and who might gravitate towards it, and what doors might open. I can honestly say that having this platform has opened doors for me. And it was just a matter of me, believing in myself, and taking a chance on myself. So, which sounds a little bit like a fairy tale, but it really is the truth. We have to remember that we are here for a purpose. We each have our own unique skill set, and we just got to believe in that.
Indeed, indeed. And for me, the same thing. If somebody had asked me a few years ago, would I be podcasting? I would be like, no. And you looked at some of those early podcasts or listened to when we were still just audio only. I'm hoping I've come a little bit away from that. I still have a long way to go. So, but that's what we're here for. Life is a journey. Just trying to make every day a little bit better than the one before. So, but with that, thank you so much for joining us. As we conclude, I usually like to ask kind of what you're looking forward to, which is especially applicable since we just started this new year. So what are you looking forward to in 2022, either personally or professionally?
Yeah. Well, I'm looking forward to, of course, safely, of course, but just re-engaging with, the community. I had some great moments last year, but I am a lot more used to kind of being out and about a little bit more. So I hope to really engage more I'm in the, DMV area. So I hope to do more of that, because that's really what keeps me motivated and keeps me going. And yeah, I did a write up of all of my, accomplishments slash wins of last year, and I was pretty surprised, because I think, and I encourage everyone to keep track of those things, even if they're small to you, because you might be very surprised when you look back and think like, oh wow, I accomplished a lot. And also defining those accomplishments for yourself is really key. So yeah, I look forward to more of being in community, and yeah, just being, I think, being gentle, being gracious with myself and my time. I'm gonna focus on that as well. But I think there's a lot to look forward to in 2022.
Indeed. So thank you so much. That was a great way to end. It was lovely talking to you and getting to know a little bit more about all the work that you're doing. And of course, look forward to seeing whatever is on the horizon for you. I'm quite excited about the possibilities for you, and appreciate getting to know you a little bit better today. And then for our audience, I will, if you send me all of your social media handles, I'll put them in the description so people can check out you on all your platforms. Fair enough?
Thank you.
All right, my dear. Well, you take care.
All right. Bye.
Thank you for listening to Read Scholars Live. Please follow us on Facebook, Twitter, or Instagram, or subscribe to our YouTube channel.